Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness. We sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. So grab your favorite cuppa and get ready to step yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more compassionate world.
Welcome to Tea with the Experts. I'm your host, Dr. Leah Merle. And today we're diving into an incredibly important and complex topic. It has multiple layers: addiction. This conversation will approach addiction really from a trauma-informed and culturally competent perspective, really trying to recognize the unique ways in which addiction impacts individuals from different backgrounds and experiences. I am so honored to have Cassidy Leslie with us today. And Cassidy is a substance use disorder professional, or an SUDP, in the state of Washington, as well as the clinical director of substance use disorder treatment at Triumph Treatment Services in Yakima, Washington. So she brings a wealth of experience working with diverse communities, and she really has a deep commitment, I feel, to trauma-informed care. So today, her and I together, we're going to explore what addiction truly is, what we feel it is in our perspective, in our opinion, the impact of trauma, of course, on substance use and substance use disorder, and how culturally responsive approaches can really enhance recovery. So Cassidy, thank you for being here, and thank you for being on the podcast today.
Yeah, thank you so much for having me. I'm very excited to speak about this topic and dive a little deeper into it with you.
You too. I know that you bring a wealth of experience, and you have varied levels of kind of like, I always feel like just growing experience, right? And leadership opportunities. You've really grown quickly in the leadership field. So I think maybe just starting by you telling us a little bit about your background and what actually led you to specialize specifically in substance use disorder treatment.
Yeah. So I have been in the field of substance use for about 7.5 years now. I have personal experiences with family members struggling with addiction, lost some close friends to addiction, and I really felt that I had one of two choices: growing up in a home where addiction was prevalent, and I could either use my experience as a child to drive my own addiction, or I could educate myself on what addiction was and really gain an understanding of my parents and the struggles that they experienced. And I chose the decision to educate myself at a young age and really just fell in love with the study of addiction and really understanding why individuals struggle with addiction and helping them find their own journey and discover how they can meet potentials that they never knew that they could. And so 7.5 years ago, I started out as a substance use disorder professional trainee working with our pregnant and parenting women's population, which was a phenomenal experience. I worked with moms who were pregnant or parenting children under the age of 5 in a residential treatment program, which was just a very eye-opening experience for me in this field. And as I continued on in my career, I worked in a variety of different positions. I had my daughter while I was a counselor with the pregnant and parenting women, and after I had her, I made the decision to further my career and look at growth opportunities, and came back from my maternity leave as a utilization review specialist, meaning that I worked with all the patients and the insurance companies and making sure that they were approved to be in treatment and continue their treatment stay. And then shortly after that, I was sent out to our men's facility. We have an intensive inpatient men's program. And I was asked to go out there to do the utilization review. And within a month of being out there, I was promoted to the clinical supervisor of that program. And being the clinical supervisor of our men's program really developed a passion in me that I had no idea that I had. I never thought I wanted to work with men, but after being out there for an extended period of time, my passion for this field just grew so much more. And I love working with the men. I love working with all the patients, but really working with the men helped open my eyes to some barriers that I wasn't aware of, and helped me grow professionally in ways that I'm just so grateful for. And about 2 years ago, I moved into the clinical director position. And so now I oversee all of the substance use programming that happens at Triumph. And there are days that I miss working with patients one-on-one. However, I now have the privilege to advocate for patients in addiction at a much higher level. And yeah, I'm super just privileged and grateful to be able to educate individuals about what addiction is, kind of dispel some stigma around treatment and addiction, and work on making a bigger impact.
I love that. I love your story. I just really do. And talking about the stigma, I mean, really what we know from working in the field is that addiction is often misunderstood and extremely stigmatized. So let's talk a little bit about that. So from your experience perspective, like, how do you explain addiction? And, why is it essential to talk about addiction from like more of a trauma-informed approach or lens?
Yeah, so I truly believe addiction is a disease. There is a brain chemistry that comes with addiction, and it does not discriminate. We worked with individuals who grew up in homelessness. We worked with people who had extremely successful careers. I worked with individuals who've had master's degrees, doctorates. It really just does not discriminate. And it's so important for individuals to understand that, because a lot of times when we talk about addiction, you think of the individuals who are homeless on the streets, the people who are using, but it's so much more than that. And there's substances that have become socially acceptable. And so people don't see the individuals using those substances as addicts. And I'm not saying that they always are, but a lot of times there's a bigger picture to that. And when it comes to addiction, it's understanding the root cause as to why individuals are using those substances as a coping skill, and how we can help them identify better coping skills so that way they don't have to turn to using substances in those moments. It's really important for people to understand that, one, you're not alone if you struggle with addiction, because oftentimes individuals who are struggling feel alone. They feel that no one else understands them. They feel that they're going to be judged. When all honesty, there's a lot of people out there who are rooting for individuals to get recovery and are willing to walk alongside of them in those moments. But anyways, it's just important for people to understand like what addiction really is, and that it impacts everyone, and that there are reasons that individuals struggle with addiction. They don't just wake up one day and say, I'm going to be an addict and I'm going to go get high on meth because that sounds really fun and exciting. There's a lot more to an individual and their addiction, and just helping them understand the why behind that.
So true. You're absolutely right. I love the fact that you said that. I really truly believe in the disease model of addiction. And people do not, in my experience, and all my experience of being a clinician, I'm sure for you too, they don't just wake up and choose. This is not a choice. This is a world that they are pulled into by circumstance, by environment, by genetics. There's a lot that goes into that. So I think the next question for me is really focused on trauma. I mean, I do a lot of work in the mental health field, and it crosses over into the substance use disorder field as well. But talking about how trauma influences the development of addiction, and what are some ways that trauma might show up in the lives of individuals struggling with substance use. I use the ACEs scale and the ACEs research when I'm working with mental health clients as well. So what are your thoughts about that and the trauma influence on addiction?
Mhm. Yeah, trauma is one of the biggest factors when it comes to addiction. Oftentimes, when speaking with individuals, they don't realize how much their trauma has impacted them and drove their addiction throughout their years. A lot of times, individuals experience pretty traumatic events as a child, like Leah talked about with the ACEs, and identifying like how our environment really impacts us and helps develop who we are as individuals, as we move throughout life. A lot of individuals who struggle with addiction experience addiction in their own homes, and it was normalized for them. I can think of many patients where we sat down and talked about their story, and they talked about mom or dad using substances right in front of them and then teaching them at a really young age that it was acceptable to use these substances, and that's how they coped. And even sometimes giving them those substances to use. I've worked with people whose parents gave them substances as a baby to get them to be quiet and to comply with what they wanted them to do, so that way they can feed their own addiction and what that looks like. Um, I've also worked with individuals who felt that they had a normal childhood, but maybe experienced divorce or experienced traumatic events with their parents and didn't know how to cope with that, which then turned into symptoms of mental health. And they wanted to numb those feelings, and so they turned to substances, which then later turned on into an addiction. And so mental health and addiction go hand in hand. It's really the chicken or the egg theory, right? Which one comes first? And no one knows, because sometimes our addiction comes after the mental health symptoms, or sometimes the mental health symptoms appear after the addiction started. They really just they go hand in hand, and it's so important that we talk about both at the same time and treat both at the same time. And it's important that we make sure we're treating patients as a whole.
Love that, Cassidy. Can you talk a little bit about your experience as the clinical director at Triumph regarding integration and treatment? Because it is essential. I'm a huge, big advocate regarding integration, and really you can't have one without the other. I'm a really big component about that. Talk to me about your experience of treatment, what that looks like, and what does the integration look like?
Yeah, so there's been a huge push over the last few years about making sure that we offer integrated care. And at Triumph, we do offer integrated care. We have mental health counselors as well as substance use counselors in all of our programs. And at first, it was difficult because you almost feel like you're stepping on each other's toes. However, what it comes down to is just full communication and really understanding the patient. Because as an SUD counselor, I may learn things about my patient that they don't tell the mental health counselor, and vice versa. The mental health counselor may learn things about the patient that they don't tell their SUD counselor. And it's just important that we come together and talk about what that looks like, so that way we can fully understand the patient and identify how we can best serve the patient. If we aren't working together as an integrated team, it's just a disservice to the patient. They're only getting bits and pieces of the care versus the entire care that they need and that they deserve as an individual. And really, oftentimes, we'll talk about, like for SUD, we'll talk about behaviors that an individual is experiencing. In a term that is used often in substance use that just gets under my skin is patients not being patients being out of compliance. They're not complying with the standards. They're not complying with the expectations that we have. And I myself have worked really hard with my team on understanding, like, there's a reason behind those behaviors. And so we have to take our own expectations as to how we think our patients should act and really understand why our patients are acting that way, and why they're experiencing these behaviors. You know, a simple example, working with pregnant and parenting moms, we expect all moms to be maternal, and we expect them to just have uh, the motherly skills. However, that's not a reality. We have to stop and take an individual's experience as a child into consideration and take their trauma that they've experienced throughout their lives into consideration when it comes to parenting, because it comes out in different ways and it's going to look different for everyone. So, we talk to our counselors about abandonment. We talk to them about trauma. We talk to them about attachment concerns and why mothers may not be feeling that they can attach to their children and why they may not be responding in ways that we want them to respond. And just really, really taking the time to understand the patient and the behaviors that drive, or the issues that drive the behaviors that our patients experience.
Yeah, it is such a trauma-informed approach that you're talking about, which is keeping that trauma of the individual in mind, but also it's culturally sensitive, because what we do know is that differing cultures deal with addiction in different ways. And so I hear you really speaking about that integration and kind of putting the human being at the forefront and kind of not coming from more of an archaic, backdated model, but really treating the individual in 2024, right, with the research that we have today. So I think that's really important. What would you say that trauma-informed approaches look like in practice? So you've talked about the way that you talk to clients, but I'm thinking about more of like a treatment perspective, like on a day-to-day basis. What does that look like? What does trauma-informed treatment look like, especially in the PMW program? Because I feel when moms have their babies with them in treatment, I mean, that's significant. That's a significant benefit for their recovery.
Yeah. I mean, it looks a wide variety of different ways, but making sure that being mindful of how our own environments, the treatment program itself, can be triggering to patients, helping the staff be mindful of when they're feeling triggered and when they're experiencing their own traumas and not projecting that onto the patients. And then taking the time to just, again, really understand the patient and how the environment can impact them, and changing the environment if needed to be more trauma-informed for the patient and the individual. We do work with a wide variety of cultures in our programs, and each culture looks a little bit different, especially when it comes to raising kiddos. And so being mindful of maybe some of the beds that are used, some of the blankets, some of the clothing, some of the parenting techniques, and being able to change our ways to be more culturally responsive and more trauma-informed, responsive to our individuals and what that looks like.
Yeah, no, I love that. I'm just thinking as you're speaking about you're talking about different cultures and the way that they parent. I'm thinking about one element of that, like discipline, right? There are varying different discipline techniques dependent on one's personal experience and personal culture. And, we have to take that into consideration. I'm wondering if I know you've got lots of stories because you've been doing this for a long time, but is there anything you want to share with our audience regarding personal stories or narratives that you've experienced in your times in the field where you've really seen recovery happen? We know.
Yeah, absolutely. I've had the privilege of being in the field long enough that I can really see long-term recovery for individuals. And I've told quite a few people this, but there are a couple individuals that come to mind where I was their counselor and they really struggled in treatment. They just thought anything that we put into place for them while they were in treatment. And there were some patients I was like, oh man, I hope that they get it, but I don't know if we're gonna get it this time. And they just pushed back every chance that they could. And those individuals have now come back and are my counselors or our coworkers within the field. And in those moments, it is just amazing. It's oftentimes we talk with patients and we share the same things over and over and over again to the point where we feel like a broken record. And oftentimes people are like, well, what's the point? Why do you even do that? And it's because if we repeat the same thing over and over again or accept the same patient over and over again, they may be coming into that conversation or into that treatment episode with a whole new different perspective. And at some point, the hope is that light bulb moment just goes off for them and it just clicks. because every time that we hear something, we're hearing it from a different perspective. And recovery doesn't just happen overnight. Relapse is part of the process. People are going to go relapse, but we hope that they come back. And maybe this time is going to be their time. And for me, it's just really important to never take that opportunity away from someone, to always just keep accepting them, be there when they're ready. And then the hope is that someday it's going to stick and that they're going to come back. And I've had the privilege of seeing that happen. I've had the privilege of seeing moms be on the course of termination for their parental rights and turn that around and have their kids reunified. And then years later, come back and visit. And we get to see the kiddos and chit chat with them. And we get to sometimes see them be counselors or sometimes we'll get a phone call and say, oh my gosh, I've just celebrated 6 months clean and sober, and I'm now working on my dream job, or a year sober, and got into the careers that they wanted. And those are the moments as an SUD counselor, and I'm sure as a mental health counselor, that keep you going. And it just reminds you why you do the work that you do.
Yeah. Why do you do the work that you do? That is such a big question. And so I'm going to ask that question in a different way. I've been asked this before about the work that I do. What gets you out of bed in the morning? Like, why do you keep coming back day by day by day? Like, what is that for you? The why behind what?
Yeah, I mean, that's such a loaded question, right? For me, it's helping people find hope again. And oftentimes when individuals come in our doors, they don't have hope. They don't feel confident in who they are, just feel like there's nothing more for them. Oftentimes their head's hanging low, they're not making eye contact. They don't want to sit there and have a conversation with you. And I have the privilege of watching them grow in such short periods of time. A lot of times individuals, even within our 28-day programs, which is not long enough, but even within our 28-day programs, you'll see individuals, they'll start to smile again. They'll start to laugh again. They'll start to make eye contact with you. And they'll start to believe in who they are again and start to find their drive to keep moving and to keep pushing forward. And it's just such an amazing experience. And I just feel so privileged to be able to experience that with so many individuals day in and day out. Because everyone deserves a chance at recovery. Everyone deserves to be treated as humans, and everyone just deserves to feel seen and to feel wanted and needed.
Yeah. Well, that's beautifully said. Absolutely. I completely agree with you wholeheartedly. And it is not always an easy job, right? This is not always an easy field to be in, but finding that hope and seeing recovery happen before your eyes is just really, really beautiful. And I know that community support, family and support in a tandem with treatment can be really kind of powerful in recovery, but what role, I guess that's my question, what role do you see community support playing in treatment? Community support and family support. Let's kind of start there. How does that support folks in treatment?
Yeah, no one can do it alone is really what it comes down to. And in treatment, honestly, like with the SUD and the mental health counselors, like we're not the experts in everything, and we don't want to be the experts in anything. And we rely so heavily on our community partners in a wide variety of ways. And so part of that community is individuals within the community kind of and talking about the resources and meeting the patients and taking the time to understand how they can help and be of support, and really just relying on each other to make sure that the patients receive the care that they need. But also having them engage in community meetings, whether that be NA, AA, Al-Anon, Smart Recovery, Celebrate Recovery, anything like that. It's teaching the patients or individuals that there are people out there who can connect with them and who walk these through these processes and what that looks like. But also on the family side of things is helping the families understand that there's support out there for them, and helping them understand their loved one and how they can support their loved one, but also acknowledging that their loved one's addiction has impacted them as well, and to receive the services that they need and the support that they need, but also helping the patient understand how their addiction has impacted those around them. addiction doesn't just impact the person who struggles with it. It impacts everyone. And it's really important that we acknowledge that.
Really, really important. I completely agree. I think that alongside treatment, really focusing on helping clients, patients, folks that are struggling with addiction and are in recovery, kind of would build those supportive relationships in their communities and with their families. I know as a family, like a clinician that works with families, that's something that I definitely support within my position. What about resources? Because you talked about a lot of great resources then, but there are barriers to treatment, to an individual getting into treatment, right? Huge barriers. So can we talk a little bit about community resources, support systems that you recommend? You talked about some groups, recovery groups, but let's talk about that for a little longer.
Yeah, I mean, there are barriers, and sadly, we can't get rid of all of those barriers. But there are a lot of individuals who are out there and willing to support peer support services, whether it be through Triumph or Merit or Comprehensive or Barth. There are individuals really just doing outreach work, trying to make people or let people know, like, we're here and we're ready to walk alongside of you and what that looks like. So there's recovery resources, there's medication resources. Sometimes it's getting patients on medication assisted treatment. There's a lot of providers in our community who are taking the time to really understand addiction and how they can support those who are struggling with addiction when they come in contact with them. Our law enforcement is really taking the time to understand addiction and how can they partner with treatment providers around the community to make sure that individuals are receiving support versus just being incarcerated, and then starting the cycle over and over again. One of the really cool things that makes me proud of Yakima is how willing the community is to come together and talk about the barriers and the gaps in our community around individuals being able to receive services and really partnering together to work through some of those gaps. Is it ever going to be perfect? Absolutely not. But I can't tell you how many times I've sat in a meeting where there have been doctors and nurses and attorneys and judges and treatment providers and law enforcement who just come together and said, hey, we know this is a problem, and what can we do as a community to support the individuals who are really struggling? It's not something that you see in a lot of communities. Yakima as a whole is really taking the time to, one, acknowledge that there's a problem, because we can't fix something if we're not willing to acknowledge it. But taking the time to acknowledge that there is an issue and then finding ways that we can partner and lean on one another to work through that.
Yeah, that's really, really great. I mean, I know that you're doing a lot of external work in your role right now. And, there are certain projects going on. I mean, how can treatment providers, addiction treatment providers, and more about society in general, I think, because there is a stigma, there is a huge stigma regarding addiction. But how can treatment providers, society in general, anybody who is kind of in the community, how can they be more culturally aware, less stigmatizing to support these individuals? Like, what are your thoughts there?
Honestly, I think it's just taking the time to talk with people. Take the time to hear someone's story. Take the time to sit down with someone and acknowledge their presence, and really just be open-minded. I've been in the field 7.5 years, and there are days where I'm like, oh my gosh, okay, I've seen it all, I've heard it all, but I haven't. I am still learning every single day. And there are often times that an issue will arise or a concern will be brought up, and it's like, well, that's a new one. Let's go ask some questions and find ways that we can work through it. But really just taking the time to be open-minded and ask those difficult questions and just understand people. Everyone just wants to be heard, and everyone just wants to feel connected and cared about and like they are human and not just another number or another statistic that's going to be put out there.
You're talking my love language, like really, the humanistic approach and treating individuals, seeing them, hearing them, being compassionate, being empathetic, and just really seeing them with the human element kind of in mind, which I think is really important. If there was somebody out here listening to this episode, what advice would you give them? If they were struggling with any of the themes that we've talked about here, addiction, substance use disorder, mental health issues, trauma that is kind of impacting them, what would you say?
I would say be willing to get out of your comfort zone. No one's ever grown in their comfort zone, and no one's ever received support when they weren't willing to speak up. There are people out there who care about you. There are people who are going to walk alongside of this process with you. And yes, it is scary, but be willing to take that first step and know that we're going to walk alongside of you with that. There are people who've experienced similar situations and are willing to talk to you and walk through every part that they can to show you that it is possible.
Yeah, absolutely. And then what about, individuals who are supporting loved ones through addiction that were listening to this? Like, is there any advice that you would offer them? Any kind of suggestions that you would give?
Again, be willing to speak about it. No one can help you if you're suffering in silence. So talk about it. Be willing to ask the questions. Be willing to be interested in learning about the resources, but also be willing to have that conversation with your loved one who is struggling and maybe better understand what they're going through. And also know that they may not be ready now. They may not be ready tomorrow, but they may be ready at some point. And to continue to keep having those conversations and don't give up. There's hope out there.
Yeah, there is. There absolutely is. And also, people change when they want to change. They have to be able to get to that point of wanting the change themselves. And so I think that sometimes it is frustrating for people who are watching. They want the individual to get help, but they're just not quite ready. When they're ready, they will be ready, right?
Absolutely.
Yeah. Is there anything else you want to share? Any final kind of thoughts that you've got today, Cassidy, regarding your experience in this field with addiction and recovery?
My hope is that everyone continues to remain open-minded and continues to be willing to learn and educate themselves and just ask the questions and put yourself out of that comfort zone. And you're always going to remain arrogant if you're not willing to take the time to understand. We don't know. And so oftentimes it's easy to live in the world of that'll never happen to me. That'll never happen to my loved one. And oftentimes when reality comes and slaps you in the face, it's almost humbling in those moments. And so just take the time to educate yourself and take the time to speak with someone.
Beautifully said. Absolutely. Such a wonderfully hopeful note to kind of close on today. So thank you so much, Cassidy, for being here today and sharing your expertise and your wisdom regarding the important work that you're doing out in the community, specifically in the Yakima area and the Washington state area to support people through their recovery journeys. This is definitely hard work. So thank you for being here.
Yeah. Thank you for having me and listening to me. I appreciate it.
And then to our listeners, of course, thank you so much for joining us today on this episode of Tea with the Experts and Dr. Leah Merle. I really hope today's conversation has offered some valuable insight, maybe some more information for you to reflect on regarding the complexities and the multiple layers of addiction and the importance of trauma-informed, culturally sensitive care. I really am an advocate for culturally sensitive and multiculturally focused care. I think it's incredibly important. Again, this is one perspective and one view. And so there are multiple perspectives out there regarding addiction and the addiction field. But if you did find this episode helpful, then please subscribe to the podcast, share it with others who might benefit. Join us next time for more discussions that aim to destigmatize mental health, promote cultural competency, and really foster a more compassionate and inclusive world. Please subscribe for more helpful insights. Until next time, take care of yourself and each other. Bye for now.